All right, let's get into this. I think we've all been there, right? You're in a hospital, maybe a clinic, or you're with a family member, and a nurse walks in, clipboard in hand. They're asking questions, they're taking measurements, but what is actually going on? Today, we're going to pull back the curtain on that clipboard and uncover the incredible story it tells. It always starts like this, with a human connection. A calm voice, maybe a gentle touch on the arm. And yeah, on the surface, it's about making you feel comfortable. But underneath all of that, this really deep systematic assessment is already kicking off, turning every little observation into a blueprint for your care. And that's the million-dollar question, isn't it? That clipboard, it's not just a checklist. Not at all. It's more like a detective's notebook, a blueprint for getting you healthy. And it's really the first chapter in a patient's story. So come on, let's peel back the pages and see what's actually inside. Okay, so first things first, before anything else can happen, they have to build a physical baseline. And trust me, this goes way beyond just jotting down a few numbers on a chart. This is the bedrock, the foundation that pretty much every other decision is going to be built on. It seems almost too simple, right? Height and weight. But these two measurements are absolute cornerstones of your physical profile in any kind of healthcare setting. They are the first two dominoes that set off this whole cascade of clinical decisions. So why the big deal about these simple numbers? Well, it all boils down to two things: safety and precision. I mean, just imagine for a second the danger of getting the wrong dose of a really powerful medication just because of an off weight measurement. Or think about how doctors track if a treatment is even working. A lot of the time, it's by watching these numbers. Everything is connected. Oh, that's a great question. What do you do for patients who are stuck in bed, or maybe they're too frail, or they have an injury that literally keeps them from standing up straight? Well, nurses have some incredibly clever workarounds for this exact problem. And check this out. This is one of the most brilliant solutions. So on the left, you've got the standard way we all know. But look at the right. By measuring the ulna, that's the bone in your forearm that runs from your elbow to your wrist, nurses can get a surprisingly accurate estimate of a person's height. I mean, how smart is that? It's just a fantastic example of real-world medical resourcefulness. So once they have your height and your weight, they can figure out your BMI, or body mass index. Put simply, it's a quick and dirty tool to get a snapshot of your nutritional status. It helps them see if you might be underweight, overweight, or somewhere in a healthy range. And the math itself, it's actually not that complicated at all. It's just your weight in kilograms divided by your height in meters squared. That little formula gives healthcare pros a standardized way to look at your overall nutritional health. And here's what that number actually means. The result of that quick calculation slots you into one of these categories. And this is super useful because it helps flag potential risks, like malnutrition if your BMI is too low, or other health issues if it's too high. It basically guides the next steps. All right, let's move on, because once that physical profile is locked in, the nurse's job kind of shifts. It goes from data collection to straight-up detective work. Now, they're on the hunt for hidden risks that could make recovery a lot more complicated. Now, if a patient can't move around much, pressure injuries, you probably heard them called bed sores, are a massive concern. They are painful, they can lead to some really nasty infections, and the thing is they are almost entirely preventable. So spotting that risk early is just absolutely critical. This image right here is so important because it shows you exactly where the danger zones are. See, any place where a bone is close to the skin. We're talking heels, elbows, the lower back, even the back of your head. That spot becomes a potential hot spot when you're lying down or sitting for a long, long time. So how do they figure out the level of risk? Well, they don't just wing it. They use a standardized, scientifically validated tool called the Braden scale. And yeah, you'd find this on that clipboard too. The Braden scale is just a brilliant system. It looks at 6 key things, like can the patient feel and react to pain or discomfort? How much is their skin exposed to moisture? How much are they up and moving around? What about their nutrition? Each of these factors gets its own score, and together they create a total risk profile. And that total score tells you everything you need to know. A high score, like a 23, that's fantastic, no real risk. But a score down below 9? That's a huge red flag. It means the patient is at a very high risk, and that triggers immediate action, like getting a special mattress or putting them on a strict schedule for turning. All right, another huge risk, especially for older patients or anyone who's feeling weak, is falls. The World Health Organization has this very formal definition, but the consequences of a fall can be, well, devastating. So preventing that inadvertent trip to the floor is, a massive priority. And you guessed it, just like with pressure injuries, they've got specific tools for this too. A Falls Risk Assessment Tool, or FRAT for short, helps the nurse look at everything medications, mobility, even a person's state of mind, and then build a custom plan to keep that patient safe on their feet. Okay, but here, this is where we see great nursing go from being a science to being a true art. Because a patient isn't just a collection of numbers and risk scores, they are a whole person with a whole life story. And that context, well, that context is everything. I mean, think about it. A nurse has to consider where that patient is in their life's journey. The needs of a tiny baby are so vastly different from a teenager, or an adult, or someone in their 80s. Understanding these developmental stages is just fundamental to providing care that's actually appropriate. And it goes deeper than just physical stages. Psychological models, like Erickson's stages here, help nurses understand what a person might be going through on a social and emotional level. Is an older adult maybe struggling with feelings of purpose? Or is a young adult feeling isolated? This kind of insight totally shapes how a nurse communicates and provides support. And this classic pyramid, wow, it frames the entire mission of care just perfectly. Maslow's hierarchy reminds us that before anyone can even think about healing or self-improvement, their basic needs for safety, for warmth, for rest have to be met. But amazing care doesn't stop at the bottom. It moves up that pyramid, addressing our need to feel like we belong, to feel respected, to care for the whole person, not just the diagnosis. So let's bring this all home. Let's pull all these different threads together. What does all of this information, from a measurement of a bone in your arm to deep psychological theories, what does it all create in the end? At the end of the day, every number, every observation, every score on that clipboard is a piece of a giant puzzle. And when you put them all together, they form a complete picture, a picture that lets the healthcare team move past some generic treatment and create a plan that is for that specific person, for their body, their risks, their life. Which brings us right back to where we started. That clipboard? Is it just a checklist? No way. It's so much more than a list of tasks. It's where science meets humanity. It is the very first draft of a patient's story of healing. And yes, it's written with data, but it is completely rooted in dignity. And that is what a nurse really sees.